Good evening, Los Angeles. Greetings from City Hall, and thank you for joining me on this Sunday. This was our second stay-at-home weekend, and I know for so many people, this has been a lonely journey. I happen to be Jewish, but one of the things I love when I go to church, and especially in the African-American church tradition, is when you come to the pulpit, the first thing you do is you thank God for waking you up this morning and for being here. I think all of us feel that preciousness of life these days. Each day when we wake up and we open our eyes, even with the heaviness on us and the sadness that we have, that we are still living and breathing, that we are smiling, and that we can see the sunshine in each day, even as we navigate this tough moment. I want to thank everybody who's been on the front line this weekend, even as others have done their duty while staying at home. Our grocery clerks, our nurses and doctors and medical technicians, those who clean the buildings, those government workers who never stop, our police officers and firefighters, and so many others, whether they're driving a truck or working a forklift at the docks or in a warehouse, who are making sure that we don't just survive this, but that we get through it together. I know this was particularly painful for Los Angeles because yesterday and today, this was the first time that we saw across Southern California our iconic beaches and trailheads, the parks that define who we are, the views that greet us at our best and worst moments weren't there except in our imaginations. But I want to thank all of you who have done your part, who are serving your city, serving its people, and serving this world by ensuring that each one of us is steeled for the fight ahead and doing the necessary work of staying at home whenever possible. And to the businesses that have stayed closed, thank you. And to those that are still open and working hard, making sure that the essential needs we have as human beings are met, thank you as well. It's not that life stops during all of this. In fact, it continues. Babies are born. We mourn those who die. Great human beings like Joseph Lowery, one of the lions of our civil rights struggle in America, who passed this weekend. We don't have to stop living and stop remembering and stop feeling, even as we stop seeing each other face to face. And I hope each one of you, as you settle into this temporary normalcy, knows that a much more beautiful world awaits us, one that we will return to and maybe even cherish that much more. I'm also pleased that the federal government has just announced that it will extend its physical distancing guidelines until the end of April. And I hope that the Trump administration will take the further step of requiring all states to adopt the same safer-at-home measures we've adopted here. This virus is nasty. It will cross borders. It ignores states. It is no longer about containment. It is about a uniformity of action that we all are called to in America, across this great land, and throughout the world. I shared with you on Friday what it was like to speak with over 50 mayors around the world on a conference call Friday morning, to hear the pain of the mayor of Milan, everything that they're going through in northern Italy, to hear from the mayor of Seoul and how they jumped into action, and to share those things and the courage it took for mayors like the chief minister of New Delhi to declare that he would shut down a city, leading an entire country of 1.3 billion people to follow. We know that we are not alone, even as we feel it. We are together with one another, but we need that uniformity of purpose in this country, and I hope the administration will continue to promote that even more aggressively. Tonight, let me share an update on a few things, as I always do. On data, the numbers that you need to know, announcements on new actions that we are taking to save more lives, and new information on programs that are in place but need a little bit more punch. With that, let me begin with tonight's data snapshot. We've been working with the Center for the Study of Los Angeles at Loyola Marymount University to reach out and to talk to Angelenos about what we're all thinking in the midst of this and what we're doing, what our households look like, and understanding that better so we can confront this fight together. The good news is that the preliminary numbers, and they're still out in the field calling Angelenos and getting their opinions and information, the good news is that the preliminary numbers show folks support the actions that we've taken. Preliminary numbers, nearly 95% in the city and county together, know what we are collectively doing is the right thing. But the numbers also give us an interesting picture of life right now in the midst of this pandemic. As we know, many Angelenos have taken a financial hit. Again, these are preliminary numbers and more will come in, but 60% of us already say that our income stream has been significantly or somewhat reduced. That's why DC, Washington, D.C., needs to do even more. I thanked them 2 days ago because it was the end of one week in which they were productive. But I warned them at the beginning of this week I was going to ask for more, and we all should ask for more from Washington. Not just in the economic survival package that was passed, but one that will look at the economic recovery ahead. What we can do to get workers, get renters, get businesses, and get America back on its feet as quickly as possible when that date comes for us to both come out of doors and also get back to work. In the LMU study, a third of the people surveyed also told us that a third of the households in the Southland have people with a serious or underlying medical conditions. Also, a third of households have somebody 65 or older in them. That means that as we all live together, that a third, at least a third of us, have the very most vulnerable people, not someplace else, but right there alongside us, which is why your behavior, even if you are healthy and young, is so important to their survival. And LMU also showed us that 80% of Angelenos are worried that they or a family member will get sick. But listen to this, only 40% think they actually will get sick. We all need to act like we know we will get sick. If 80%, and it should be more like 100% of us are worried, we have to assume that we will, which is why every single action we take is so important. And I thank you again for your adherence to that. Also, close to 60% of you said that you think it's the right strategy when you get sick to isolate. And that's good, but that number should be even higher. And nearly 40% in these preliminary numbers think that you should go to a doctor. Let me dissuade you of that second. You should talk to a doctor, get on the phone with a doctor, and unless you have serious symptoms, make sure that you are isolating. Because if we have people rushing the medical facilities that we have, especially as this pace picks up, especially those who are not exhibiting serious symptoms and are healthy, we will be overwhelmed at our hospitals. We want to contain household and community spread. So don't go to a doctor unless you think it's severe. And think through the places and spaces that you live in so you don't expose others where you live. Dr. Ferrer has taught us this. Public health professionals have said it over and over. But the next phase of this fight we have to be ready for is not just the physical distancing of us between households, but the isolation and quarantining we need to do within the spaces where we live. And let me just say at the outset, I know that is very tough for some households where people are packed together, where there aren't two bathrooms and one can't be put aside for somebody who's sick. But wherever possible, please exercise that and know that the county is talking to us and other cities about any measures we can do to help folks who don't have those spaces be able to quarantine when they are positive someplace away from the rest of the household. For more information, take this Sunday night to go online and just re-review at publichealth.lacounty.gov all those frequently asked questions, so that when somebody does get sick or is positive with coronavirus and COVID-19, you will know what to do right away. And those precious days at the beginning where separating the family from each other can help slow the spread. I think a lot of families figure, hey, if I'm going to get sick, we're all going to get sick. That's the wrong approach. If you get sick, you have to do everything you can to make sure nobody else in your household does get sick. and everybody in the household has to do everything they can to make sure they don't get sick as well. If everybody's sick in the household, who goes and gets the groceries? What happens when people go outside? This spread, one person, as we've seen, can lead to 10,000 cases in just a matter of weeks. So take this part seriously and spend some time getting to know the number of days you have to quarantine, if you have symptoms, what you should do, and if you are positive, what happens next. Don't just take distancing seriously. I hope each one of us will take isolation seriously too. You see, isolation and quarantining together with physical distancing are the twin weapons in this fight. And if warnings weren't reason enough to take this seriously, then here's the latest data. Some of you may have heard, but let me re-announce that today in Los Angeles County, there were 332 new confirmed cases of COVID-19, bringing the total to 2,136. This represents a 16% increase from yesterday. In the city of Los Angeles, there were 181 new cases, bringing our total past 1,000 for the first time to 1,020 cases, an 18% increase. And additionally, and the worst part of each one of these evenings is saying this number, that there were 5 new deaths, bringing the countywide total to 37. This was a 14% increase from yesterday. And I mourn, and all of us mourn, for those who lost a loved one today. We are with you, we feel your pain, and we will mourn alongside you tonight. Next, I want to update you on the stats on testing. I mentioned on Friday I thought we'd get to about 5,000 tests. We wound up doing 6,741 tests total, administered by our Los Angeles Fire Department, and thank you to our brave firefighters and our personnel department, who has helped step up, not just for city employees, but by and large for residents of LA. And the 6,741 tests we completed, we feel confident that we will double that pace this week and have triple the number by the end of the week, 13,000 tests completed, with a pretty quick turnaround time of 1 or 2 days. Tomorrow, we're opening up a 5th testing location, and we have a capacity of 2,300 tests tomorrow, and we've only filled 1,300 of those so far. So I encourage Angelenos to go to coronavirus.lacity.org to see if you're eligible to get tested. And if slots are filled for a specific day, we've now updated the system so you'll be automatically rolled to the next day so you can make an appointment then or for a future date. Los Angeles is also continuing to work day and night to add beds and resources to address the urgent needs of unhoused Angelenos. On Friday, we successfully opened 5 more recreation centers as shelter for those who are homeless. And today we are at 91%. That was from a couple hours ago. We may be close to 100% capacity as I speak across those sites. And that's in addition to the more than 900 motel and hotel rooms that the state, LAHSA, LA County, and the city have secured for isolation and quarantine. And some of them are already serving people who are waiting for test results or who have been exposed to the virus. And as soon as the middle of next week, we hope to have additional hotel rooms available to serve as emergency temporary housing for the most vulnerable. So far, we've kept up with that pace, but we're going to need more. And we're going to ask more hotels and motels to step up and help us save lives. So tonight, I'm announcing a way that if you own a hotel or a motel or know somebody who does, how you can help out. For both those folks who need a place because they have no home to go to, and for those who will need a place to isolate as well. If you go to coronavirus.lacity.org/rooms, you can sign your hotel and motel rooms up now. We hope that you will today. We know that you've been suffering. If you're a hotel or motel owner, this is a great way to not only keep the business going, help keep us safe, but also do something about the issue of homelessness in this city. Please step up. We need you, and we need your help. And now, thanks to the state of California, and thank you, Governor Newsom and the legislature for your extraordinary work, but Governor Newsom helped us get 535 camper trailers next to our recreation center shelters across the city. These are a critical addition to our infrastructure for protecting the lives of our homeless neighbors and all Angelenos during this crisis. And the deployment of these trailers means that when a person at one of our shelter sites shows any symptoms, we can right away get them quarantined or isolated and have a place for them to safely be. The first of these 25 trailers arrived this weekend at the parking lot of the Westwood Recreation Center, and soon they'll be in place at rec and park centers across the city. And I want to thank LAPD, I want to thank Recreation and Parks, the city's Bureau of Engineering and Sanitation. They've all been working around the clock to make sure that those trailers are properly installed, have the hookups that they need, and making sure that we're all healthier when they are there. So those are the numbers, the data, but let me now talk about what we're doing to flatten the curve and to save lives. We all know we have to do everything possible to add to the supply of hospital beds. I've talked to so many friends who work in hospitals who right now, they're rearranging all the spaces and the places, looking at places to put beds, adding equipment wherever we can, planning for local medical staff and equipment for the surge we know is coming. And we took a significant step to relieve the hospital overcrowding with the arrival on Friday of the USNS Mercy, 1,000 hospital beds now in the great port of Los Angeles that are here to help our non-COVID-19 patients be someplace safe and to relieve a bed for a COVID-19 patient in a local hospital. And I'm proud to announce that the first 3 patients are already on the Mercy. Now, we're making another key contribution to the effort of surging beds by turning our convention center into a field hospital. A federal medical station led by the United States Department of Health and Human Services, which dropped off that equipment and we unpacked it this weekend, and about 30 brave members of our National Guard who helped us today set that up. We're starting with medical supplies and cots so we can relieve some of the pressure on nearby hospitals, and we'll provide more details in the days ahead. But we're going to need your help, and I appreciate all the medical personnel who have stepped up, offering to volunteer in whatever assignment we have, and we're certainly going to be calling on some of you to help us at the convention center. One of the core challenges we face in this crisis is twofold. First, how do we help local hospitals that are quickly running out of essential supplies and personal protective equipment? And second, as we fight tooth and nail to locate those items, how can we get them to our frontline doctors, nurses, and medical professionals? As our healthcare system handles a big surge of patients and prepares for more, these are the twin questions that are becoming the next massive undertaking in our fight against COVID-19. We need someone with a deep well of experience to get the job done, which is why I've appointed the Port of Los Angeles' Executive Director, Gene Soroka, to act as our city's Chief Logistics Officer. His job is to use our purchasing power, our connections at the port with logistics, transportation, assets, information technology, and manufacturing relationships to secure critical materials that we need in this fight, from healthcare and other vital industries, like I mentioned a couple days ago from our apparel industry and others. He's going to help us manage the process of getting the 1 million masks currently in storage out to our first responders, along with a second supply chain to help our hospitals get everything they need in bulk. So the city will act as an intermediary, trying to centralize that and helping hospitals that need further help get their equipment. Gene won't do this work alone. He's assembled a team to order, track, expedite, and deliver COVID-19 supplies and to stay coordinated with our county, state, and I hope as well federal authorities. I cannot overstate how important this work is going to be to our health and to the fight ahead. By putting Gene in this role, he will save lives. Finally, let me tonight update you on some of the programs that are ongoing and get you up to speed on our efforts to bring relief and services to Angelenos who are affected by COVID-19. First, an update how we're strengthening our testing system to ensure we're delivering more kits and getting faster results. I mentioned the numbers first, but let me give you a little bit more. Beginning tomorrow, we're launching a new partnership between the City of Los Angeles, UPS, and the health and wellness company Everlywell to bring COVID-19 testing access to seniors and people who are experiencing homelessness, two of our most vulnerable and susceptible populations. This will be administered by healthcare professionals, and everyone in this partnership is doing what they do well. Everlywell is supplying the testing kits and making it easy for you to view your results securely online. UPS is delivering securing the kits, distributing them, and then shipping the samples overnight for quick analysis at Everly Wells' network of labs on their dime. And the city is making sure that the test kits are available to providers who can get them to the most vulnerable people. That includes CalPACE providers who specialize in delivering care to older adults in assisted living. We saw what happened in Seattle. I asked for a solution, and we figured out a way to work with doctors who work with seniors and our senior homes to make sure that we can avoid outbreaks in our senior homes. And this also includes community health care providers on Skid Row, the shelters at recreation centers across the city, and 8 federally qualified health centers in our cities that have expertise in serving people who are among the poorest and oftentimes homeless in our city. And just as our private sector partners and city departments have been stepping up to serve, our city council is moving quickly to bring relief to Angelenos who need help. On Friday, our council members took historic action to cut back red tape and allow the city to allocate discretionary funds much more quickly during this crisis to bring relief to our first responders, families, and COVID-19 victims. The council also took an important step to protect workers during this crisis by requiring businesses to provide supplemental sick leave to workers affected by COVID-19. That means if a healthcare provider requires you to self-quarantine, if you're caring for a family member that's under quarantine, if you're 65 or older or have an underlying medical condition, or if you're caring for a family member whose care has been disrupted, you may be eligible for 80 hours of additional leave. The protections will go a long way in safeguarding the health of all workers, those who work at essential businesses and those who are safer at home. My friends, this is a crisis unlike any that we have faced. We're marshaling resources from everywhere we can. Since the first moments of this crisis, you have stepped up. And you know, people have asked me a couple questions. They said, every day, is it working, Mayor? Is it working? Well, stay at home is working. We always have work to tighten it up, to crack down, all of us collectively to ensure people are distancing, and that we continue strengthening the order. But that part is working. The second question, though, is always, is it slowing the spread? My honest answer is, it's yet to be determined. That's as much in your hands as it is in mine. We know that slowing the spread will take some time to see, and it will still be a week or two before we see the impact of the historic and brave actions that each one of you took before many cities in America did, because that is how long the lag is. And then third, people ask me, but are we winning? Mayor, are we winning this fight? Well, only time will tell us. Only time will tell us whether that one time you didn't go out saved a life, whether you're working on a construction site and you took seriously, as we will start on Tuesday with our inspectors out there, to have a COVID-19 supervisor, and everybody took it seriously. Only time will tell whether when somebody got sick in your household, you did everything you could to separate everyone else from that person while ensuring they could get through this. Only time will tell whether we could step up and procure the masks and keep our health professionals healthy and serving everybody. Only time will tell what all that we have done amounts to. But I want you to know that I don't just have hope. I'm going to end where I started. I have faith. I have faith in a higher power than all of us, but I have faith that He has given us the ability to do what's right, to make the decisions that will save the lives of our fellow human beings. We're racing against time with every fiber of this city's being. But I know that in the midst of the fog of this battle, we will march through, and we will march through together, and we will get to the other side. And so I thank you on this Sunday evening for all that you are doing. We've seen that spirit in each one of us. I got off the phone about an hour ago with a man named Mark Fuller who heads up Wet Designs. We've all loved his and his workers' fountains, whether it's at the Port of LA or Bellagio in Las Vegas. Those fountains that dance and sing, they're made right here in Los Angeles. They're designed and engineered and built right here in LA. They don't need supply chains from other countries. They have everything they need. And he said, we jumped into action to make sure we could start making the protective facial visors for our doctors so that they don't have to wonder when somebody's coughing on them whether they're going to bring that home, and they know they can show up the next day. Thank you, Mark. And thank you to everybody who has stepped up out of the generosity of their hearts. I've seen it in the can-do spirit of some of the pillars of our community who are making personal contributions that we're redistributing to those who are the worst off in this city, and making sure that those who are bypassed by federal legislation are still seen as human regardless of their immigration status or where they come from. In fact, tonight we received new commitments of $500,000 each from Willow Bay and Bob Iger, from Marilyn and Jeffrey Katzenberg, from Kate Capshaw and Steven Spielberg, from Ellen Bronfman, Hauptman and Andrew Hauptman, from Meg Whitman and Griff Harsh, and from Casey and Laura Wasserman, each of whom is leading with deep generosity, $3 million more towards our goal of the $25 million to help healthcare workers have childcare and seniors to have meals, and the least among us to be able to eat and pay our bills. Corporations have stepped up, from Sony Corporation that answered the call when we opened up our homeless shelters so that folks who are unhoused can follow the news and know what's best for their health in each one of those shelters. Mark Stern, who I mentioned, who's the chairman of TCW Group, made a generous contribution, and together with CEO David Lippman established a matching program for their employees to donate. It's the big ones that matter, and it's that $10 donation of a grandmother on a fixed income who called and said, I want to help too. Everything matters, and they're making a difference in people's lives. So continue to give, whether it's to a local church or synagogue, a food bank, to the United Way, or to the Mayor's Fund at mayorsfundla.org, where we are marshaling these resources together. One last note before I close is the FBI published a study that predicts another kind of heartbreaking surge. They said that an increase in hate crimes during Asian communities during this health crisis, Asian and Pacific Islander communities. And I just want to say we have no tolerance for racism in our city. It's not even vaguely who we are. This is a city of belonging for everyone. A virus is a virus. It does not discriminate or care who you are or where you come from. But the strength of our values and this city comes from the way that we pull together. It can reveal the best of us, and I intend for that to be the case even in the midst of the tragedy we will march through. So we ask how we can help here in this city, not how we can hurt. We take care of our families and communities and support those in need. So as we enter a new week, my friends, be kind to each other, to the folks that are stocking the grocery shelves. Say thank you to a delivery person and pause for a moment and just connect with them. Give a call to someone you know who may be struggling or all alone. 20%, the Loyola poll said, of people have no one to take care of them in their family or outside. So check on that neighbor. It might be them. And most importantly, make those decisions that will save lives. So Los Angeles, as I always say, stay safe, stay healthy, and stay home. Strength and love. Thank you. With that, I'll take some questions.
Thank you, Mayor. Our first question comes from the line of Jory Rand with ABC 7. Your line is open. Please go ahead.
Hi, Tori.
Mr. Mayor, thank you for taking our calls. Really appreciate your last sentiment there. I do have a couple questions about testing.
Yes.
I know there was another testing facility set to come online this week in East LA. We know there are also asymptomatic people out there right now not showing symptoms, and it will take a long time to get everyone tested in a city and a county this big to know who has it and who doesn't, even with 10,000 tests per day. So can we ever get to that level? Also, the president said 2 weeks ago there would be drive-up testing at facilities like Walmart and Target. Has that happened anywhere in LA or anywhere that you have heard of? And this one might be getting a little bit ahead of ourselves, but when will you feel comfortable lifting the restrictions with the testing results? Even if numbers are going down, as long as the virus is still out there, won't it just ramp back up once people are released from physical distancing? Thank you very much.
Absolutely. Let me start with that. Thank you for those questions. First of all, Absolutely, we're going to be listening to public health professionals. I'm not going to make a political estimation. I'm going to make a public health estimation. And when they say it's safe, that's when we'll be releasing this order. As we look, though, at other parts of the world, we see very clearly that this doesn't happen in a matter of days or just a couple weeks. As I've been telling people, we should be prepared for what every expert's told me about 2 months, and then assess at that point where we're at. It won't even be a week or two before we see whether physical distancing is helping us knock that curve down. And remember, and maybe I'll do this one of the evenings so people can kind of get a deeper understanding, is just because you see the charts go like this, that's the absolute number. The curve you want to bend is the rate of increase. We want to keep this from doubling and doubling and doubling quickly. So of course during this crisis we'll see that line continue to go up. That by itself shouldn't scare you. It's if the rate of increase continues to, then we're really in a bad place. So we're going to look at data like that and make the decision. One last nuance on that question. It may not be that we all are released at one time too. The mayor of Milan in Italy was telling me as they're looking at what comes next, as they're starting to see a little bit of light, quite still far ahead of them, but some light, is it may be that some of us can go back to work while others who are more vulnerable should stay at the stay-at-home order. So we will assess that. We will talk with Dr. Barbara Ferrer and other health professionals and take their guidance as she gives for this entire county before we make any of those decisions. In terms of drive-through facilities, you'd have to ask Catherine Barger tomorrow, but she has told me that Walmart, I know, up in her supervisorial district in the Antelope Valley was looking at drive-through testing. I don't know if it's up and going yet, but I know that they have certainly looked at that. I haven't heard of that at any other stores yet. We know there's a lot of technologies about to come on. Many people looked at the one that is a 15-minute test. It'll be great when we have that, but there's only 50,000 of those being made in the first batch. Many, if not all of those, are going to be in New York. So it's going to be some time, even as we read about breakthroughs, before people ramp up those tests. Which gets to the first question. I don't see us getting to a point where we can test everybody anytime soon without some kind of national either direction and or miracle. In other words, the number of cases is accelerating more quickly than the number of tests. I hope we can meet at some point and start to have those rates of increase be about the same. That's when we can have the sort of information we need. And when I told everybody in this press conference, you have to get to know not just physical distancing, but social isolation, this is the piece that I want you to hear again. Dr. Ferrer has been great about saying this. You know, the job of public health, and she has hundreds of people, I think they just added another 150 people, is literally one day, you know, it was a few hundred, but soon it'll be 1,000 new people a day who we find out are positive. They have to then call from county public health, each one of those people. Do a tree of who have you been in contact with. Try then to get in contact with that tree of people. Think about that. That might be 1,000 people times 50 people each. And make those phone calls and get that word out, because that's how we can also slow it. It's not just the randomness of the times we physically distance ourselves from anybody who might have it. This is now when we know people do have it or have been exposed to it, and letting other people know, especially when they're asymptomatic and not showing that they too have to think about quarantining themselves. That can help us knock this down. And the more we do, the quicker this will be over. The less we do, the longer this will last. Next question. Thank you.
Our next question comes from the line of Steve Gregory with KFI Radio. Mr. Gregory, your line's open. Go ahead.
Hey, Steve.
Thank you, and good evening, Mayor.
Good evening.
Thank you for taking my question. I've got a couple. First of all, we've been hearing from law enforcement that are patrolling and doing security for the makeshift homeless shelters, and they've got some serious concerns because it was characterized to me that some of them are packed in like sardines, and they seem it's very counterintuitive to what everyone's being told to do, and they actually are in fear for their health. Also, your hotel-motel program, I don't know if you clarified in there or not, will the purveyors of these hotels, motels be paid through a fund? And finally, on the field hospital, are those for non-COVID patients? Thank you.
So working backwards, the field hospital will take the direction from the county of whether initially they had indicated it would be non-COVID patients. Now they're saying maybe it would be a place for COVID patients with less symptoms or lower symptoms. We're just going to keep building, and they, as the doctors, will tell us what they need, and we'll just keep building that capacity. In terms of the hotel motel, yes, it is. We're not asking people to donate those. That there is money in that. We think that's a FEMA reimbursable expense, and certainly the federal government has indicated that that is a proper use of slowing down a public health emergency. And then in terms of the shelters, I've been hearing a lot of reports, and it's quite the opposite. I'm sure you can get that anecdotally, but we have only taken the advice of the county public health on the spacing, and people are screened before they go in there as well. So they are screened to be healthy, so nobody's going in there, and then it's not like we're getting them in there and then taking their temperature before they even get on a bus. That screening happens ahead of time. But of course, in any population, especially folks who have been living on the street and who have been traumatized, we want to make sure that we have for them the care that they need. The County Department of Mental Health has been in each one of those, and we appreciate their presence there. 2 full-time police officers who are also trained in mental health, de-escalation, et cetera. And it's our expectation that it doesn't matter whether you're housed or unhoused, physical distancing is physical distancing. So that is something that is really in the culture of these places. Sometimes people are arriving for the first time and it takes a day or two to settle that culture in, but we're seeing the same people begin to come back to those places, settle in, and understand how important this is. It doesn't matter whether you have a house or not. You want to save your life and you don't want to get sick. And so the more we can educate anybody, no matter where they live, the better they can take care of themselves, and that's certainly something we're doing very aggressively in those shelters. Next question, please.
Our next question comes from the line of Lee Roth with Fox News. Your line is open. Please go ahead.
Hi.
Good evening, Mr. Mayor.
Good evening.
On your call for all 50 states to issue stay-at-home orders, what's the help to Angelenos if people in, say, Vermont stay at home? And does your call to the feds extend to the closure of airports for personal travel?
So all of us are interconnected. I know we feel like these borders between us are physical borders. They're not. There aren't people who guard the border between California and Nevada, unless you count the slot machines. There are no ways to keep people right now from traveling. And I think it's also misplaced a little bit. The idea of containment now, we're past that. Every country said, oh, if I can just contain people from coming in. Every state was starting to say that. But it's already, the bigger spreader in any community already is the community spread that's there. So that said, those states that are going to be further ahead in getting out of this curve, if other states are slower, trust me, you will not only get to where we are. I loved when everybody was saying, oh my gosh, is LA the new New York, just like New York was the new Italy, and Italy was the new Iran, and Iran was the new China. Everywhere is the next everywhere. That's my point. With this virus, no place will be immune. I talked to the mayor of Oklahoma City, David Holt, who's a good friend. They're a day behind us per capita. As I've shared a couple times here, due to per capita, at least this was the case 3 or 4 days ago in Wyoming and North Dakota, it's the same or a day behind Los Angeles. This isn't red or blue. This isn't coastal and heartland. This is an everywhere thing. And as such, I love our federal system. I love that California can go its own way from a different state. But the federal system says that we should have strong national leadership for very important things: war and defense, trade, international relations, and a public health crisis. So the idea that only local governments or state governments in a patchwork way will figure out how to procure things, manufacture things, what stay-at-home orders they have and not. I'm glad that we led this from Los Angeles, but we need the entire country to do it. It's not to prove us right, it's to protect us. That person in Vermont, trust me, has some connection back here. As in terms of air travel, I think that's the guidance we need from CDC or the federal government. I don't mean to call for it, but to make that decision. We can't make that just as a city. If you did one city closed and another one, that's something that has to come from the federal government. So I don't think we take anything off the table. I'm not suggesting tonight, before I'm misquoted in a bunch of headlines, that we close down all our airports, because there's critical first responders, nurses that are flying in from different states who've been retired, who are now helping us in the hospitals. There may be a need for us to still have air travel, but there is also a need for us to have a national standard. Thank you. Next question.
Our next question comes from the line of Carla Hall with LA Times. Your line is open.
Hey, Carla.
Please go ahead.
Hi, Mayor. I have 3 questions, but they're all related to homelessness.
Okay.
The first one is, you said something about there was a case among the homeless population. that was being investigated. Do you know for sure if that was a case that was positive yet? And you said now there's 13 rec centers that are open. Do you have a number total of how many homeless people are now in these rec centers? And then last, you mentioned hotel and motel rooms, and I know LASA is working on this. You said that by the middle of next week, you hope you can have some of those rooms available for homeless people. I'm not talking about sick homeless people, but I mean just homeless people. Do you have any sense of how many of those rooms might be available?
So the first person I was told yes was a confirmed positive, who was the first homeless Angelino to be COVID-19 positive. They were then at Dockweiler Beach, where there had been campers set up there, and that person was taken into isolation and medical care. So that's the information I had from 2 days ago. It was then confirmed, and we have not heard anything otherwise that they weren't. And I believe they came from the city of Los Angeles, but I don't know where in the city of Los Angeles. Second, the capacity. We have a little bit over 540 beds. Each gym is different. They were 91% filled, like I said, I think 2 hours ago. So basically 100% filled tonight, we think, or close to. We expect to be about 97 to 100% filled. Can't do the math on the fly, but whatever that is, into 540. And in terms of the beds available, yes, one of those beds, I believe, in the first case was used in a hotel motel. So some are online for those who are afflicted with COVID-19. But I hope as soon as possible, because while we're opening up another 13 rec centers this week, pretty heroic work by amazing employees and led by Christina Miller, my deputy mayor, who's doing this work, and her team, we would love to have double the number of beds open. And if that can be done through the hotels and motels, but LASA has been doing a good job putting those together. I have no reason to believe that those won't be available this week for folks who also are just at risk and especially vulnerable. And as I said a couple weeks ago, we had already gone through and taken the 4,000 most vulnerable Angelinos experiencing homelessness. So these are people who already have some sort of either medical or physical susceptibility and or are over 65. And those folks, we are looking at trying to get away and off the street as much as possible as we begin the testing at Skid Row tomorrow, as we move with more tests to help identify who they are. Okay, thanks. Next question.
And our last question comes from the line of Emily Alpert Reyes with LA Times. Please go
Emily.
ahead.
How are you?
Hi, Mayor. I have two questions about tenant issues.
Sure.
The first is that in some apartment buildings, renovation work is continuing. So tenants who are stuck inside complain that their water and internet has been interrupted, that workers are coming in and out of their buildings for work that's largely cosmetic, such as upgrading vacant apartments to make them more marketable. Why is this work being permitted to continue, and do you believe that renovations in existing buildings are an essential business right now? Second of all, tenant activists have said that under the eviction restrictions, renters can defend themselves from eviction filing.
Sorry, can you slow down a little bit because I couldn't quite catch the words? Will you say the second one a little slower?
Sorry?
Will you just slow down a little bit? I couldn't quite catch it on the speakerphone.
Sure.
Thank you.
So my second question was, I've heard from tenant activists who are concerned that under the eviction restrictions, renters can defend themselves from an eviction filing if they have a COVID-19 related hardship, but that still requires them to go to court to do that. How will people's health be protected if they have to physically go to a courthouse in the middle of this pandemic to respond and defend themselves against an eviction filing?
Good. So the second question is easy. There are no court hearings on this. They have been canceled and there are no court hearings. So good decision by the courts. They've closed them on all of these cases. There is nobody who is meeting. So nobody will put themselves in the midst of this. And that's something I 100% support. So this is only for after we're already done with all of this. Meanwhile, the eviction protection that is there ensures nobody will be evicted during this. And that right now it's 6 or 12 months now from the council action, I believe, that folks will be able to repay that rent. In terms of the tenant issue, I do believe absolutely when we need people to be spacing out and we're already overcrowded, that is critical. But I will give a warning again to anybody doing those improvements, 6 feet or we'll shut you down. We have inspectors that will be going out to work sites. Every work site has to have somebody who is in charge of that COVID-19, who's using PPE. And if you're not even though we need those badly. We need that to relieve the spaces so that people will have places to go, so that people don't double up right now, strangers who would move in with each other because we'd stop the completion of that apartment. That's a health risk. So we looked very closely at that, talked to public health. If they give us different direction, we will, as we've had to do many times, heavily restrict further, but, I mean with a heavy heart, not heavily restrict. But that said, right now, we absolutely need as many places and spaces where people can space out. As long as people can do that work while abiding by the public health restrictions, we will see that as critical, yes. Okay, thank you very much. I'm going to say some words in Spanish again. Thank you, everybody, for tuning in. We will see you all tomorrow if you're tuning out, and we'll switch our interpreters. Thank you, as always, to our interpreters. Okay. Muy buenas tardes, Los Ángeles, y gracias por venir. Bienvenidos a la alcaldía. Este fin de semana fue la segunda que tuvimos que pasar en casa. Y quisiera agradecerles a todos por cumplir con este orden que mantiene a todos seguros y en buena salud. Hoy tuvimos 332 nuevos casos en el condado. Ahora tenemos 2,136 total en el condado de Los Ángeles. En la ciudad ahora tenemos 181 casos nuevos, llegando a un total de 1,020 casos en la ciudad de Los Ángeles. Además, fallecieron 5 personas más, creando un total de 37 fallecidos en el condado de Los Ángeles, un aumento de 14% desde ayer. Y lo siento mucho por las familias, por sus perdidos. Nuestra ciudad comparte el dolor con todos quienes han perdido un ser querido, un amigo, un vecino. Estamos ampliando nuestra capacidad para hacer pruebas de detección. Hasta hoy hemos completado 6,741 pruebas y para este jueves tendremos este número duplicado a 13,000 más. Mañana abriremos un quinto sitio. Tenemos capacidad para 2,300 pruebas mañana y hasta ahora hemos llenado 1,300 citas. Por favor, visite la página web coronavirus.lacity.org para saber si eres elegible por una prueba. Y si ya no hay citas disponibles para mañana, hemos actualizado el sitio para que puedas escoger otra fecha. También estamos trabajando día y noche para agregar más camas y recursos para nuestros vecinos sin hogar. El viernes abrimos 5 centros de emergencia adicionales en nuestras instalaciones de parques y recreación, creando un total de 556 camas. Gracias al Estado de California, podemos instalar 535 caravanas en nuestros sitios de refugio temporal en la ciudad. Además, tenemos más de 900 habitaciones en hoteles proporcionados por LASA, la Autoridad contra la Indigencia, y el condado. Estas caravanas y hoteles son críticos en nuestro trabajo para proteger y salvar vidas durante esta crisis. Este fin de semana llegaron 25 caravanas al centro de recreación en Parque Westwood y pronto estarán por toda la ciudad. También tenemos que hacer todo lo posible para aliviar el estrés en nuestros hospitales médicos y preparar para el aumento de personas quienes necesitan apoyo y asistencia. Con el buque USNS Mercy, tenemos 1,000 camas en nuestro puerto para pacientes quienes no tienen coronavirus. Y hoy convertimos la sala sur de nuestro centro de convenciones en un hospital. Será una estación médica federal dirigido por el Departamento Nacional de Servicios de Salud y 30 miembros de nuestra Guardia Nacional. Y gracias por su trabajo. En los días que llegan tendremos más detalles sobre esto, pero es muy importante este arma contra la batalla en la batalla contra coronavirus. Además, nuestros hospitales necesitan suministros y materiales. Hoy he nombrado al director del puerto, Gene Soroka, para operar como el jefe de logística para la ciudad. Estamos afortunados de tener a Gene y su experiencia con nosotros en este trabajo. Finalmente, quisiera informarles sobre algunos programas que tenemos en operación. Primero, estamos ampliando nuestro programa de pruebas de detección. Empezando mañana, empezamos una colaboración con UPS y la compañía de salud y bienestar Everly Well para brindar más pruebas administradas por un profesional médico a personas mayores y personas sin hogar. Además, el Consejo Municipal tomó acción histórica para eliminar las medidas burocráticas y permitir que la ciudad pueda gastar fondos de manera más rápida durante esta crisis. Esto le dará el alivio necesario a trabajadores, a familias y socorristas en Los Ángeles. Y el Consejo Municipal también tomó la decisión importante de requerir licencia por enfermedad para empleados afectados por el COVID-19. Esto significa que si un médico te ordena estar en cuarentena, puedes recibir hasta 80 horas pagado de trabajo adicionales. Esta es una crisis como nunca hemos visto y muchos han ofrecido su ayuda de varias maneras. Seguimos recibiendo donaciones muy generosas. Les sugiero a todos que sigan este ejemplo de generosidad. Si pueden ayudar, por favor, visite la página web mayorsfundla.org para ayudar. La semana pasada también el FBI publicó un informe con otra noticia triste. Hay un aumento en crímenes de odio contra nuestra comunidad asiática durante esta crisis. En esta ciudad no toleramos el odio ni la discriminación. La fuerza de nuestra ciudad es nuestra gente que ya ha llegado de todo el mundo. Este virus no discrimina y tampoco la haremos nosotros. Sin embargo, esta crisis puede revelar lo mejor en nosotros. Somos generosos, cuidamos a nuestras comunidades y a nuestras familias y apoyamos a quienes necesitan ayuda. Amigos, quédense protegidos. Quédense en buena salud. Quédense en casa. Fortaleza y mucho amor. Thank you all so much. We'll see you tomorrow. Be strong.